Hey everybody, it's Dr. Tiffany at Sioux Chiropractic, and I have Zoe with me. You guys have probably seen Zoe around the office. She is our new chiropractic assistant, and she's wonderful. We love her. She treats our patients so well, and today's going to be her first adjustment with me. She's been adjusted before, but actually never in our office. So I'm going to let Zoe kind of tell us about like some of the pain you used to have and your past experience with chiropractic, okay?
Yeah, so I used to run cross country, and one problem that I had is super tight hip flexors, and I still have them to this day. So that has caused a lot of back pain too, lower back pain I would say. Yeah, and just overall makes life a little bit harder.
Yeah, so she was telling me actually she's a little bit nervous. So she said when she's gone to the chiropractor previously, it's been really painful, like to the point of tears, which is, but she always felt better after, right? Yep. So I'm trying to reassure her, we do things a little bit differently here. I don't want it to be a hurt. I want it to be a good hurt, if that makes sense, when we're doing muscle work and working on some of these really deep muscles. But we're gonna see if we can't change her experience and that fear a little bit, okay? Because chiropractic is very safe and it should be comfortable, okay? So Zoe, what we're gonna do is we're gonna take you through ranges of motion. We've done your orthoneural. You're clean as far as getting adjusted. We're gonna test her low back, but I'm also gonna check the rest of her body. Everyone on my team, I want them functioning optimally. That means I want all the areas of the spine moving so we don't ever have pain, okay? So we're gonna check everything preventatively and then keep it good and keep my team just operating on all cylinders here, okay? So I'm gonna have you stand right here and face the camera, and you're gonna mirror me, all right? So the first thing I'm gonna have you do is we're gonna go through your upper body. So I want you to turn one head all the way over one shoulder. Good, any pain or pulling?
No.
Good, other side. Any pain or pulling?
No.
Nope. Chin all the way up. Any tightness or pain?
No.
Awesome, chin all the way down to your chest. Any tightness or pain?
No.
No, awesome. All right, you're gonna go ahead and face the side for me. I want you to touch your toes. Hey, you're close. You're really, so she really has to even shift back to get into that. Go ahead and touch your toes one more time. Good, awesome. Come on up, arms straight up, and you're gonna follow those as far back as you can go. Good, any pain or pulling with that?
No.
No, awesome. Okay, so one test we're gonna show you with Miss Zoe is, I'm gonna have you sit right here.
Okay.
And Mads, you can kind of go right here. And I'm gonna have you grab one knee and rock back onto your back. Good.
Oh, you have to move up a
A little bit, there you go. Good, okay, so what you guys are seeing is absolutely how tight her hip flexors are. So she's quite straight, so I'm not super worried with adductor or iliopsoas tightness. So your adductors are gonna be on the inside of your thigh. We are worried about iliopsoas. I'm not worried about her abductors or these really tight TFL muscles and ligaments and fascia over here because she's straight. So she's not having pull side to side. She's just having a ton of flexion. And we're gonna go up and address this iliopsoas, which is kind of lays right in here and actually attaches to the back of your spine, creating that tight hip flexor. All right, go ahead and come on up, Zoe. Grab the other side, rock on back. Good. So this side, if you can see, this one actually pulls out just a little bit, so it's not perfectly in line. If I showed you the other one, this one actually pulls a little bit, so I am worried about a little bit of abductor tightness over here on this left side. But same as you saw from the other side, still quite a bit of iliopsoas tightness and tight hip flexors, right? All right, girl, come on up. Okay, so what we're gonna do is I'm gonna feel what's moving well in her spine and what we could maybe improve upon. So I'm gonna do the motion palpation scan, and I'm gonna just go side to side and up and down, starting at the base all the way up to the bottom of her skull, and see what we need to adjust. So I'm gonna start in her SI joints. I'm just challenging P to A, posterior to anterior. Gotta get tall here for me, Zoe. There you go, beautiful. Ooh, you feel the difference? Mm-hmm. Yeah. So I always say it's like pushing into a block of wood when it's moving good, or a block of cheese, there's a little bit of give. There's no give here. So this is a brick wall. So this, I'm gonna log this in my brain, that she's not extending like she should be at her PIS on the left side. Okay, then we're gonna come up and we're gonna find the lumbars. The lumbars actually have very little rotation. Most of our rotation should come from the thoracic spine. So that's why I'm just challenging her lumbars and just straight P to A, that straight up and back. You feel a little bit right there, don't you? Yeah. So we'll kind of find that with someone who likes to cross their legs. Do you cross right over left or left over right? Yeah. So she's a little bit corkscrewed. So this SI joint on Zoe is loaded a lot, but she's also in rotation. So her L5 vertebra is locked as well, more on the right side when I'm challenging posterior to anterior here. And that goes perfect. I always look really smart when I'm like, you cross right over left, don't you? And they're like, yep, because it goes perfect with that kind of corkscrew pattern. So I'm gonna keep going up. A little bit of tightness and stiffness right at this TL junction. And she's kind of stereotypical. Most people, I'm gonna find the big problems right at the transition areas. So that's where your sacrum goes to your lumbar goes to your thoracic and up. And just like that, this TL junction where the thoracic meets the lumbar has some stiffness, just not gliding like it should. Good, I'm gonna have you interlock your hands, Zoe, and go behind your neck for me with those. There you go, perfect. Elbows in. And then I'm just gonna challenge here. Oh, she's got quite a bit of thoracic stiffness. Do you feel that? Mm-hmm. And then with our thoracics, that's actually where we get our rotation. So we can challenge, and it's moving right here. You feel that? Mm-hmm. So her right rotation with thoracics and extension, right near that TL junction at the bottom of her thoracic spine. And she's just got stiffness the whole way up, to be honest. Those upper thoracics right there too. Ooh, good, bring it down. Awesome. Good, so I'm gonna bring your head all the way back. Are you comfortable with that? Mm-hmm. Good, and what I can feel when I do that is literally her upper thoracic spinous processes opening and closing, and I want those to open and close, and that tells me about that extension and flexion capability. Nothing right there. Right there at that CT junction, so again, right where the thoracics meet the cervical spine, I can go in and challenge, ooh, bub. A little bit of rotation. Remember, we get most of our body rotation, not from the lumbars, but from the thoracics, and right there. You feel that? Mm-hmm. You can't wait to get adjusted. Are you nervous? Are you clamming up? What do you feel?
A little bit.
Okay,
no,
good.
Excited.
Just talk to me. I know, I want you, you're gonna feel so good. I want you to be excited, okay? But if you start to get nervous, let me talk you through it, okay? I always say, people always apologize for like being nervous or not like, or stiffening up when we go to adjust, and I'm like, it's not normal to let somebody just like have their way with your body. Mm-hmm. But I love that you trust me enough. Okay, so what I'm feeling right now is I'm taking my hands right on the posterior aspects of the cervical spine, and just like in the rest of the spine, I'm going P to A. I'm feeling that spring posterior to anterior. And if I feel it's not moving, that's when I'm going to take it into that additional rotation. Right there. Good. You feel that? Mm-hmm. Left lateral flexion. Good. Yeah, she's got a little bit of a, I'd say like just like a block where she just doesn't want to laterally flex right at the top on the left. And then right near the middle as well, she doesn't want to rotate and extend. So we've got quite a few findings on Miss Zoe. So we're gonna, you haven't been, how long has it been since you've been adjusted? You said high school.
Yeah, like 3 years probably.
Yeah. Oh. So with anybody that hasn't been adjusted that long, expect some soreness, okay? Just like if you hadn't hit the gym and had leg day in 3 years, we're challenging your body in different ways. It hasn't moved like this in a while. And also the adjustment is a micro trauma. To get everything to move, I'm gonna have to disrupt some tissues that have been settled that way for a while, okay? So let's start, I gotta remember back, left SI. I want you to lay on your side and face me, okay? So previously, whenever you'd been adjusted, was there like a lot of popping and clicking? Like was there a lot of like cavitation is what we call it, like that popcorn?
I think so.
Yeah, absolutely. So we call that cavitation. I always ask patients who've been to another chiropractor, you know, some of us use the clicky, some of us use our hands, some of us use this drop table that kind of like gives way underneath you. Here at Sioux Chiropractic, I use everything. I do what I need to do to get the job done, and also whatever the patient's most comfortable with. Okay, so I'm working on this left SI joint right here. And remember, it wasn't extending. So I'm going to put her in a position, straighten this, where her body is going to extend with me, okay? So I'm going to have you hold on to yourself right there. Okay. So I've got a really good grip on her right here. She's on the table. The nice thing about Zoe is she's very petite, so she makes my job easier. So I'm going to move. Whenever I move this top knee up and down, that's exactly like opening and closing or flexing and extending right at the SI joint. So I'm moving this to find the spot where she's most locked, and it's right here. And then the rest of her body, I'm going to bring her into extension. Good. And then I'm going to use my body to give it a little bit more force. Good. And it's not huge. Mm-hmm. Should be comfortable. How'd it feel?
Good.
Good. Mm-hmm. All right, let's go on the other side. So we're going to extend her. I'm just going to have her stack this. I don't want her twisted. Okay, all the extension I want right at her L5. I don't need her whole body twisted. I'm trying to keep this really comfortable. And to do that, let's disrupt as little as we have to and adjust. I mean, you can pop your fingers every 15 minutes. Just because we make noise doesn't mean it's a productive noise. I only want to do what's necessary, especially with someone that's a little bit hesitant to be adjusted or had painful experiences at the chiropractor previously. So same thing, I'm going to take it through flexion extension here at L5, because remember, that's going to open and close those spinous processes, and it's going to tell me exactly where I need to be at. So I checked her seated, I checked her on her side, and I know the same spot I'm finding. So it's just double confirmation that I'm doing the exact right thing. So I'm going to bring her to me. And then same thing, I have her in a little bit of extension. I've like kind of packed my snowball and put all my forces into this L5 area. And then I'm going to use my body to create a little bit of a drop. How'd it feel?
Good.
Good. All right, let's go. Go ahead and sit up for me. We're going to work on that TL junction and that upper thoracic. Then I'm also going to palpate the front of her pelvis and figure out what's going on in her hips. Okay. Okay, give yourself a hug there.
Okay.
Awesome. We like black here at Sioux Chiropractic. I don't know if you guys can tell that, but it's really unfortunate because we have some construction going on, so we're all just a little covered in dust after we leave at the end of the day. Okay, hold on to yourself right there, and that'll give you something to do with your fingers. So the same thing, the same way I palpated her when she was sitting, I can do the same palpation where I'm putting her into that extension, or tuck your chin to your chest. I can put her in a little bit of flexion too, if that's what she needs. She doesn't need flexion, she needs extension. Good, all right, relax that head. Good. So I've got my hand under here, and that's creating the extension I need. She's very small, she doesn't need a big brick underneath her. And then I'm just gonna use my body and her body with gravity. Good. Oh, she did need a little bit, you were stiff. Good, all right, same thing, hold tight there. And I'm to get her into extension, I'm actually gonna have to create a little bit of distraction. So I'm gonna put my hand up here, right at the top of her thoracic spine, and just distract down a little bit. And that's gonna help pull this almost, with her, it's not rounded, but this almost rounded area into the needed flexion, or into the needed extension I need. So I'm gonna grab here, tissue pull, come up above her. Doggy.
That was good.
So good. Good, no pain, right?
No.
Good. All right, so I'm gonna come, are you okay with that board under your back?
Yep.
Okay, I'm gonna come and I'm gonna test her hips out. You feel that? Mm-hmm. A little bit of a tightness here when I push down on the left. That's her right. That's her right. Chiropractors aren't used to verbalizing what we're doing, we just do it. So what I'm doing is I'm stabilizing the opposite side of her hip, so her left hip, but her right hip's the restricted one, so that's the one I'm putting the force through. Then I can come back here, and she's still really, really tight in that. I'm gonna put this in like a figure 4 here. Good. So that gives me just even a little bit more of that, putting her more into the position she needs. There we go. Can you feel the difference there? Mm-hmm. Good. It's definitely palpating and moving a little bit better than it was. Awesome. Come on up. if you can remember, she didn't have anything going on in your neck. I'm gonna just check it. We found a couple of areas when we were motion palpating, we were seated. This is to prevent, this is preventative. We wanna keep everything moving, we wanna keep the wheels turning, because pain is the last symptom. It's the last thing to appear in dysfunction, and it's the first thing to go away after we've adjusted it. Like I said all the time with patients, I'm gonna adjust you, you're gonna feel better. Doesn't mean you're better, right? Your pain is gonna go away quickly, but I wanna change the function. So I wanna make sure that she's functioning 100% optimally, so she never has to deal with neck pain. So we're gonna come back in here and a couple areas. And remember, she had some painful adjustments. So less is always more. Even if they had a bad experience with chiropractic or not, I'm only going to do exactly what's necessary and not an inch more. An inch, an ounce. Okay, all right, so we're going to take her. She's got extension. I've got posterior to anterior pressure on the 7th cervical vertebra. So I'm pushing P to A, so that's that extension component. A little bit of lateral flexion. Oh, and she's tight and you feel that? Mm-hmm. With right rotation there of her cervical spine. And then I'm gonna take all the free motion away and add only the littlest amount I can to create what was missing. So good? Mm-hmm. Okay, good. Oh, that's better. And I can come down here and I'm just feeling posterior to anterior. That extension's totally restored and that feels great. Good. Same thing. C2 right here on the right. So I just had a little bit of posterior pressure. I took her through rotation and that released so nicely. And this is probably the biggest one we found, is the C1 on the left here. I'm going to take her, I've got my posterior pressure, adding that extension. She's got tons of rotation. I've got all the left lateral flexion. Just a little tiny bit added behind it to get that restored movement. That's what I'm after, is the functional change. I don't care about the pop. The pop's nice, but it's not what I'm after. Awesome. All right, Zoe, come on up. So Zoe's got a long road ahead of her. She's had this for years. So what we're gonna do is I'm gonna retest you. We're gonna see how touching your toes go. Okay. If you can't touch your toes, that's a problem, especially in your 20s, okay? So we're gonna get that under control. We're gonna do some muscle work, we're gonna do some foam rolling, and I'm gonna get her respirating properly so we have a good base to pull from. And obviously we're gonna keep her adjusted. We're gonna probably go twice a week for 2 weeks with Ms. Zoe, with rehab, with foam rolling, and we're also gonna do some psoas, tissue work, muscle tissue work in there, okay? So let's go ahead and stand right here, Zoe. Let's see what's better, and let's see where we still need to improve a little bit, right? Pain gets better quickly. I'm after the change in function with you. All right, so what I want you to do is face the side for me and touch your toes. Hey, getting closer. Good. Arms up, follow them all the way back. Good. Any pain with that?
Maybe a little tightness in my lower back.
Still a little bit of tightness. Yeah. Okay, go ahead and face that way. Good. Rotate all the way this way. Good. Any pain? No. Awesome. Other side. Any pain? Mm-mm. Awesome. All right, we're going to go do some work in the rehab space. If you guys have any questions for me, please feel free to comment below, like, subscribe, and share this if you know someone that wants to know more about chiropractic. Thank you.